Pregnancy loss is, well, it's an incredibly difficult and personal topic. For so many, it's a heartbreaking one-time event. But for some, that heartbreak happens again and again. So today, we're going to explore the medical search for why, looking into a condition called recurrent pregnancy loss. Let's get into it.
First, to get some perspective, it's really important to know just how common a one-time miscarriage is. The numbers show that about 1 in 4 recognized pregnancies ends in loss. Now, knowing it's a shared experience doesn't make it any easier, of course, but it's a crucial piece of context.
But that brings us to the real medical puzzle, and really, the whole point of this explainer. What's going on when it's not just a one-time tragedy? Why does it keep happening? This is the point where we shift from a common event to a very distinct clinical disorder.
And to be really specific here, the American Society for Reproductive Medicine, that's ASRM, has a clear definition. They define recurrent pregnancy loss, or RPL, as having 2 or more failed clinical pregnancies. So we're not talking about just a string of bad luck here. This is a medical condition that really demands a deeper investigation.
So that kicks off the search for a cause. When a couple is dealing with RPL, doctors start what is basically a complex medical detective case, trying to figure out what's going on from a list of potential suspects.
But here is what is so incredibly challenging about this whole thing. After all the tests, all the evaluations, in about half of all cases, a clear cause is never found. It just remains unexplained. And you can imagine how deeply frustrating that is for everyone involved.
Now, for the 50% of cases that can be explained, the investigation zeroes in on a few main culprits. You've got anatomic factors, things like the shape of the uterus, which account for about 13% of cases. Then there's antiphospholipid syndrome, an autoimmune issue, which is behind about 15%. And a smaller group, maybe 2 to 5%, are caused by parental genetic factors.
But there's another category on that list of suspects that is getting more and more attention from scientists, and that's hormonal and metabolic factors. This is where the detective story gets really interesting and leads us to a huge clue.
Specifically, a lot of research is pointing to a major connection with something called insulin resistance. You might have heard of it. It's a metabolic issue that affects how your body handles sugar, and it looks like it has a pretty significant impact on whether a pregnancy succeeds.
So what exactly is insulin resistance? Okay, let's break it down. Think of insulin as a key. When you're insulin sensitive, that key works perfectly, unlocking your cells to let glucose in for energy. Easy. But with insulin resistance, the locks on your cells are kind of rusty. The key doesn't work as well, so your body has to produce way more insulin to get the job done.
To really dig into this connection, a fascinating study in the journal Frontiers took a close look. Researchers focused on a group of 948 women who all had Polycystic Ovary Syndrome, or PCOS. That's a condition often linked to insulin resistance as they were going through their first IVF cycle.
So what did they find? How does this metabolic problem actually mess with a pregnancy? Well, the data they collected tells a really, really clear story.
Okay, this is the headline finding right here. The researchers split the women into 3 groups based on how insulin resistant they were. In the low resistance group, the miscarriage rate was about 7%. Now look what happens. In the medium group, it jumps to over 13%, and in the high resistance group, it's all the way up at 16.2%. The risk literally more than doubled. That's huge.
Seeing that strong link to early loss is obviously a big deal, but the researchers wondered, does it stop there? Or could insulin resistance also affect the development of babies in pregnancies that do continue?
And what they found was this clear chain of events. Higher insulin resistance led to a higher risk of developing gestational diabetes, and that, in turn, increased the chances of something called macrosomia. That's just the medical term for a baby with a high birth weight, specifically over 4,000 grams, or about 8 pounds, 13 ounces.
So the final conclusion from the research was really powerful. Even after they adjusted for other things like age and weight, the study found that insulin resistance, all by itself, is an independent risk factor for both early miscarriage and a high birth weight in this group of patients.
Okay, so knowing all of this, what's the path forward for people struggling with recurrent loss? How do we find answers? And maybe just as important, how do we find support?
Well, here's the standard game plan recommended by ASRM. It involves genetic screening for both parents, taking a close look at the uterus with imaging, doing blood tests for that autoimmune clotting disorder, APS, and of course the hormonal and metabolic screening we've been talking about, checking things like thyroid function.
But the investigation isn't just about what's happening physically. As the ASRM makes very clear in its official opinion, the psychological toll of this is just immense. They strongly advise that patients get psychological support and counseling, and this isn't some add-on, it is a critical part of the care.
Which brings us right back to that 50% number from the beginning. We have some solid clues, we have suspects, we have good tests, but even with everything we know, about half of all cases are still a complete mystery. And that leaves us with this huge final question. For that 50%, what else is going on? What other factors are still out there, just waiting to be discovered?